All right, good afternoon, everybody. My name is Erik Bowen, and I am a cannabis pharmacist here in Oklahoma City, Oklahoma, and I'm also the owner of Illume Cannabis Wellness. And we're here to this afternoon to discuss cannabinoids and chronic pain. And I'd like to introduce some of the other people on my on the panel. If you'd like to go, Cassandray.
Hi, everybody. My name is Cassandray Gosa. I am a community pharmacist in the state of Georgia. I'm also the founder of chirpRx, which is a telehealth company that provides cannabis therapy management to cannabis patients and consumers. We can lead it off next to Becky.
Hi, everyone. I'm Becky Brown. I'm also in Oklahoma, and I am the founder of PharmD Wellness and PharmedWell.com. And I also am now teaching the pharmacology of cannabis at St. Louis University. So I'm here in a couple of capacities and also as a patient.
Thanks, Becky.
Hi, I'm Dr. Leah Johnson. I'm a medical cannabis pharmacist. I am also the owner of Alchemist Consulting or Alchemist Cannabis Consulting. I work one-on-one with medical cannabis patients throughout the US to both initiate and to adjust their cannabis therapy. And I'm very happy to be here with this great panel today.
Thank you, Leah. Kind of what Vivian had we were going to talk about was cannabinoids and chronic pain, and she gave me like a list of like some stuff to kind of talk about, and let me pull that up here real quick. It's on my Google Drive. One of the first objectives she wanted us to talk about was understanding the different medical benefits of cannabinoids and terpenes. So I know for myself.
Hang on, Erik, I just want to interrupt a second. I'm assuming what you're referring to are the bullet points, but you guys feel free to talk about anything that you think is important. I know there are a couple of new things that are going on, stuff like that. And also I can edit anything out if there's any, oh wait, I don't want to say that, or I want to rephrase or something like that. Okay.
Okay.
But yeah, feel free to have kind of a loose conversation. You guys know what's going on and what's the most interesting.
All right. Thank you, Vivian. I know as far as what I do, as far as, looking at patients' medication profiles and, if they want to use cannabis and stuff, trying to come up with a plan that will fit them. What do you guys look for when you're searching for different products for different patients, and what kinds of questions do you ask them? Let's go ahead and start with Cassandray first.
So I definitely like to have a conversation with patients, and I really just want to understand their experience with cannabis, what their expectations are, and I go from there as far as picking their therapies. I find that, different strains and things like that can be more subjective as far as the patient goes. But I just try to narrow in on what their expectations are so I can get the correct dosing, make sure that I'm getting the correct product for them so that we can treat whatever condition that they're looking for. Nothing specific as far as different strains, sativas and indicas. I've been trying to get away from patients using those types of terms and just trying to keep it general.
Awesome. Thank you, Cassandray. How about you, Dr. Leah?
Thanks, Erik. Yeah, no, Dr. Leah, it's how I go by in the cannabis field. So Dr. Leah is totally fine. So since I do a comprehensive review on all my patients, so I get all their all their lab history, usually within the last year, and so I can, or the year before as well, so I can compare them. But specifically with products, what I do is I make sure that it's a whole plant, full spectrum extract. I always try to educate that it needs to be both whole plant and full spectrum, because full spectrum is sadly turned into, it should be a medical term, but it's sadly turned into a commercial term, just meaning meaning it has multiple cannabinoids, but the term full spectrum should mean it has the full spectrum of all the cannabinoids in the plant. So I always educate healthcare professionals working with cannabis as well as patients that the products I recommend are always whole plant, full spectrum products if it's available in their state. If there's somebody who explains that they would like to use cannabis therapy, but they will be drug tested, or they are, they're not in a state where it is allowed even for medicinal, then I make sure that they utilize broad spectrum, which is pretty much the same thing. It's all the cannabinoids, all the terpenes, all the polyphenols together, but with the THC extracted out. So that's my biggest focus after I do the comprehensive review. Just like Cassandray said, it all depends on the ailment to decide which cannabinoid profile to use. So it really can't go based on the ailment. It needs to go based on the patient response. But the biggest thing I recommend is the whole plant full spectrum.
Thanks, Dr. Leah. How about you, Becky Brown?
Kind of
I understand
similar.
you're a pain patient as well.
Yes, and I appreciate the commentary from both of the other panelists, and the multiple cannabinoids, I think, is probably my biggest soapbox. THC is the focus of medical programs, getting THC access to patients, but I think a lot of times the CBD, CBG, the other things are forgotten about because of the prohibition, creating that dichotomy between those. So, educating about the endocannabinoid system is extremely important to me, because it seems like people's therapy works better when they know what's going on, and they can kind of do those other lifestyle things to, help the cannabis do its thing. And then I just always start with CBD. So it's, pretty safe as far as people don't have to worry about the intoxication or fears and stigma and things like that. And it's kind of like a stepping stone to me. And then we're lucky in the United States, we have access to CBG and some other products that are the acid forms that are pretty readily available. They can get expensive, but so I like to use lots of different cannabinoids, not just, THC. So.
All right, thanks, Becky.
And if I can also, I'm in a state that the medical program has not really gotten off yet. And so we really do have to look at other cannabinoids. And so I also try to educate patients, THC isn't the only compound in the plant. There are other cannabinoids in there that could be effective for you as well. So that whole education is so important when talking to patients as well.
Thank you, Cassandray. As far as kind of what I do a lot, kind of a combination of everything that you guys do as well. I send out a comprehensive medical evaluation form because I want to know what medicines people are on and what types of medical history and stuff that they have. If they have things where I'm going to need lab work and stuff, like say they're a renal patient or various other things, like different drug levels and stuff, I'll look at that. And I kind of talking to the patient and their goals of therapy is one of the biggest things that, I can have somewhere that I think they may want to go, but if that's not where they want to go, I want to lead them on their journey. It's not my journey to take. It's their journey to take. And, like Dr. Becky said, incorporating other things other than just the use of medications, lifestyle changes. I know for myself, and it's kind of interesting that Dr. Leah is on here tonight, but because she's doing a thing on yoga tomorrow night, and I've been doing a lot of yoga lately, and I can't tell you how much that has enhanced my physical and mental well-being. So I try to tell people, that cannabis isn't a magic bullet or anything like that, it's just another tool in the toolbox, and just like with medications, medications alone are not going to fix us. It's all the different adjunct things, lifestyle changes, movement, what we put into our body for fuel and stuff. I mean, how we nourish our endocannabinoid system and stuff to begin with is I found very important for me. And I try to pass on, and I'm a pain patient as well, and I try to pass on what I've learned, not just in about cannabis, but about in taking back my health from being on, when I was in pain management, I was on a ton of different pharmaceuticals. Now I think I was on 14 different meds at one time, which is, I'm sad to say as a pharmacist that's horrible. I should know better, but now I'm down to 5, with using cannabinoids and, incorporating some lifestyle changes and stuff. So I try to be the authentic me and, help my patients from my experiences as well. And I found that's been very rewarding for me to be able to do it that way.
Erik, I just want to chime in on something you said actually that I thought was great. The cannabis is very helpful for the treatment of pain, but it's also very helpful for getting patients off of, or at least reduced on their cannabinoids. So that's the other huge thing. Like you said, so many patients are on all these meds, and I'm actually also a pain patient. So to join the chorus. And I've been, a lot of my patients who have come to me, they often are saying, A, my pain is not controlled and I'm on this high dose of opioids, but B, they also just don't want to be on the opioids. So it's just a combo of both helping patients with their pain, but then also helping them get off some of these meds that have a higher addiction potential, also have, and we're a group of pharmacists, so we all know that, opioids are terrible meds. They don't work well. They work poorly. But sadly, this is what providers keep giving to our patients. So it's up to us, to really help the patients get off their opioids and to get better physical care, both. And like you said, Erik, it's everything. It's not just the cannabis. Cannabis is great and it's so helpful, but it's also the yoga. And like you said, the cannabis is actually shown in studies to be really effective for actually enhancing your workouts and enhancing your yoga. And I can say myself as a patient, I have found that depending on when I utilize, especially my CBD therapy, if I do it like about an hour or so before yoga, I find that the yoga actually is a lot more physically effective than it is if I don't have a chance to utilize my cannabis therapy beforehand.
Great, thank you. Yeah, I know we've talked a little bit about that in the past, about as far as, and I've heard you say, Dr. Leah, how, just ingesting a pill or a cannabinoid or whatever isn't going to do the whole trick for us. It's all the other changes and stuff that go along with that. And for myself anyway, when I was on all the other medications and stuff, I felt so sluggish. And now on cannabis and stuff, I don't, because I know what kind of works for me. And I try not to get to the point where it's going to cause problems with me as far as, not being able to concentrate and stuff like that, because I don't want to necessarily get, I don't want to get stoned per se. I want to feel better. I want to feel in control, not out of control like I was feeling on medicines and stuff. So
if I can jump in here, Erik, I love the quality of life improvements with cannabis. And I feel like, part of it is that endocannabinoid system education. And here we are, each of us being an expert in that. Like, we know the things to do now because we've, worked with our cannabis therapy, worked with other people's cannabis therapy and our endocannabinoid systems, and seeing the differences between different people's, and how, exercise in the morning or exercise in the evening or whatever it is that works for you. But it's that process of uncovering, and like Cassandray mentioned, the patient's expectations and what are they wanting, like you mentioned, Erik. And I think it's just really important to make sure that, kind of unlike the Western model, we're actually looking at the whole patient and not just, how long has your pain been this way? What else have you tried? What hasn't worked? Or, that whole standard list of questions. I think we can do better. And with cannabis, we're able to. So yay for quality of life, right?
Yes.
Yeah, and
Thank
like
you.
you mentioned, and typically pain is the symptom of some other chronic condition. So you've got people that are diabetics or, have high blood pressure, and not only can they come off their pain medications, but they can also come off of those therapies as well. So it's just, just not looking at, my toe is broken. It's the whole body that we want to look at. So yeah.
Right,
Can we
because
start
that,
a
I mean,
movement? Sorry.
go ahead.
I said, can we start a movement?
We can. um, there's something I was going to say. Oh, as far as that's another thing I wanted to mention. We've all talked a little bit about being able to but like by myself, like I said, how many medications and stuff I was able to get off of. When you guys have patients come to you and stuff that are saying, do you ever have patients that come to you and say, I want to get off of all pharmaceuticals, say, for instance? I mean, because I have patients that say that, and I try to be realistic with them and say, first of all, I can't tell you not to take your medicines that your physicians prescribe, because I don't want to get in trouble with the physician or my board or anything like that. I mean, we're already kind of flying on the cusp here anyway. I feel sometimes, as far as being in the
I have to
cannabis
be
space.
really careful up front with people. Like if we're talking about mental health diagnoses, I'm not going to encourage you to, there's just not, I'm not comfortable with that. So I hope you have a therapist and a physician that you're working with, and we can talk about the conversation. I will talk to your doctor if you want me to. I'm happy to do that process, but not alone, me and the patient taking them off of antidepressants, for example.
Right.
There are limits.
For my patients, a lot of them actually come to me looking to be weaned off of pharmaceuticals, including epileptics. I actually had a patient who was on 300 milligrams of phenytoin every evening, and then 400 milligrams of phenytoin the other evening. So switching on and off between 300. So that's a very high dose. And I was able to get her fully off without any issue, just using a low dose of it. I actually got her fully off. She had been on the medication for over 20 years, and now she's fully epileptic medication, anticonvulsant medication free. And she did that, but it was very slow. And like Becky said, it has to be in conjunction with their provider. We are not providers. I mean, we're pharmacists, and so we're not providers. So that's the one other thing I really explain to my patients or caregivers that are interested in looking into this. You need to have the go ahead of your provider. And since I work with patients throughout, in any state of the US, I always explain in every state it's different. And if your provider is not on board, then we cannot reduce medication, because they're the ones that are going to be testing you. They're the ones that are going to say, is your blood pressure lower, to allow us to decrease it? And if they're not on board with working with you, then it can lead to harm to patients. So I always explain to patients that no matter what state you're in, you need to have a provider that's on board with this. They might be like, oh, I know nothing about it, I don't want to make recommendations. But as long as they're there to measure your blood pressure, your blood sugar. I mean, I had a patient who decided not to tell their doctor, which I had no idea about. And it ended up that actually it wasn't my patient, it was a patient of a colleague. And it ended up that they were on a great dose of CBG, and they reduced their blood sugar amazingly. Their kidney function actually increased. And It ended up that they never told their doctor. So the doctor never reduced their insulin. And the patient had to be rushed to the emergency room because they had subtherapeutic, they had very extremely low levels of blood sugar. They were severely hypoglycemic. So cannabis is very safe, but medications are not safe all the time. And everything has a dose. The dose makes the poison. So if the patient was doing great, she needed to tell her provider, so they reduced her insulin level, so this would not have been a problem. But this is why it's so important to speak, like Becky said, to speak with the provider, or have your cannabis clinician that you're working with, ask them to speak to your provider for you, just to educate them and explain and say, this is why we need your help. We need you to monitor. We need to see, because if the levels are going lower, we need to start reducing some of their pharmaceuticals as well to make sure everything stays balanced.
Thanks, Leah. How about you, Cassandray?
No, I'm 100% there. I mean, that's all great. Like I said, I definitely, Georgia's growing. And so I like to, when I'm talking to patients, I want to know who their, primary care physician is. I like to reach out to doctors and have conversations. And if they have questions about cannabis and what its abilities are, I like to have that conversation with the provider. I feel that like they're more open to not only helping that patient, but also recommending it to their other patients as well. And so that's one of the big things for me. You may not come off of all of your medications. Even if we get you off some of them, that's great. But we need to have an open dialogue with you and your provider as well.
I agree 100% there, Cassandray. And that's what I do as well. I want to make sure that my patients, PCP, and, ideally all their physicians, but, if at least their primary care provider knows that they're on cannabis-based medicine, and that, that they're honest with their provider about that. I know for myself, for a long time, I didn't tell my physicians and stuff that I was on that, and I think that was wrong. I think it's important that not only physicians can see some of the benefits, in us as patients, for those of us who are patients, by using cannabinoid-based therapies, and also to, kind of just break that stigma of, hey, I may be trying something that is a little bit different than what you're used to, but, I've educated myself on this, and, it's just another something I found that's been beneficial for me, and reaching out to physicians and being able to talk to them professionally about that, and not kind of, like people have been saying, educate the physicians, a little bit at a time. That's been proven pretty beneficial for me. As far as pain management physicians in particular, have you guys had much pushback or anything about patients using cannabis who are also on opioids? And what kind of pushback have you gotten, if you wouldn't mind saying? I'll go myself first. I actually worked with a patient who is actually my very first patient, and it's kind of ironic in the fact that once I found out who their provider was, that was my pain provider at one time, and they told me I needed to make a choice between opioids and cannabis. So I said, okay, see ya. I'm going to go ahead and choose the cannabis, and I'm glad I did, because it's improved my quality of life so much. But just in that 2 years, maybe 2.5 years since I've been out of pain management, that physicians group has done a total 180. I think they realize that if they'll look at the science and realize that, a lot of times people are able to use lower doses of opioids and stuff while on cannabis, then that will, that's good for everybody. It's a good physician, and it's good for the patient. And I just wondered if anybody else had any problems sometimes connecting with pain providers who aren't really totally 100% on board with cannabis.
So for my patients, I'm very clear with my patients, because I do, like I said before, I am extremely adamant that they have to have at least one provider that is on board and knows that they're using cannabis and is willing to follow them. And I will say to patients, and I've done this multiple times, I recommend to get a new provider. And I hate to say that, and that sounds so rude, but if your if your provider is not willing to consider the fact of an alternative therapy, and you're on a high, you're using opioids, and you have your reasons based on what you've seen in the news, what you've seen in research about why you don't want to use those therapies. If they're not willing to listen to you, that's no different than you saying, my stomach hurts. The doctor goes, well, I've checked everything. The labs say you're fine. The studies say you're fine. So obviously it's in your head. It's psychosomatic. It's like, no, it's not psychosomatic. I have pain. And it's the same thing with opioids. If your doctor's telling you, nope, you're crazy to use cannabis therapy, it's not going to do anything with you, it's a harmful drug, you're just going to get high, then find a new provider that's willing to work with you, because there are plenty that are willing, that are interested, and they might not say, I know about cannabis therapy or what to recommend, but they can at least say, if you find somebody like the four of us here that know cannabis therapy and are happy to work with you, and they say, find somebody who understands, a medical professional who knows how to use it, and I'm happy to work with you and them to get you on this therapy and reduce your opioids. I mean, that's how it should be. The whole point is we're utilizing cannabis therapy to wean down other medications, specifically opioids. So there should be no problem with the utilization of both. And just real quickly, just because somebody mentioned it before, a lot of providers go, oh, you just want to get high to the patient, or to the practitioner, or to the people like us, the practitioners who utilize cannabis with our patients. Oh, you're just getting the patient high. What people don't understand is high is an overdose. That's really what it is. If the patient is high or gets the negative euphoria that or they get paranoia or what all the other side effects, where do we get side effects from? From taking too high of a dose, just like any other medication. So what do we do instead? We just make sure that we start low, go slow, and stay low. And that's like the pharmacist mantra for everything, but especially in cannabis, and that's what we do. And just like Becky said, start with more CBD, slowly move it, increase the THC. If CBD is too energizing for some, move it to CBG. Just keep playing with the cannabinoids and playing with what works for the patients, and start low. And then, when your patient goes, oh, I slept really well, but I'm a little sleepy this morning. Okay, that's really simple. That means that the dose might have been too high, or they need to take it a little earlier in the day, just like any other medication, which all of us pharmacists can, correlate with.
Thanks, Leah. Becky, let's go to you on that.
Well, unfortunately, since I'm also in Oklahoma, I see lots of the same thing you do. It's kind of you need to pick if you're going to do pain management or cannabis. If you want me to prescribe you something, basically, is their attitude, which is really unfortunate to me. And we even have locally one dispensary that was opened by a pain management doctor, but not so that he could practice integrative medicine, just so he could benefit from the cannabis market here. So unfortunately, like my soapbox with CBD, it's not necessarily what's best for the patient that takes, precedence over everything else. But as you were finishing, Dr. Leah, I was thinking, yes, and take CBD, start low, go slow, and take CBD with it. That's always my, my thing though. Yeah, I mean, I would love to find practitioners. I feel like I've had to approach more naturopathic doctors and kind of alternative based practices, and had much more luck with that.
Thank you, Becky. How about you, Cassandray?
Yeah, I was gonna say, like, if you can find a doctor that has DO at the end, maybe, or NPH, they may be open to, or I hate to say it like that, but they may be more open to, those type of therapies. And even though I've counseled patients in different states, like I said, Georgia is a baby state, so our program is not up and running, and so I'm not getting any pushback right now. But as True Leave is about to start, growing cannabis here in the state, more providers are probably going to start hearing it from their patients, and then that's when that pushback will start coming back. But right now, I'm in that space of everybody seems pretty receptive to the possibility of using cannabis. So, I'm waiting to see if I get that pushback later.
It's like theoretically everyone's on board, but we'll see what happens in real, right?
The other thing I was going to jump into is that I know in some states, because I know I'm from California, I didn't mention that earlier, and we're, as they say, the wild west of cannabis. The most important thing I was going to mention too is in states where you don't need one of us, or you don't need a healthcare professional or anything, you could just walk in. Don't. That's pretty much the number one thing I would say is don't utilize us, utilize people who are educated in this. And the reason is I have had patients come to me after they've had an injury due to cannabis. And the reason I say it was an injury is because they went into a dispensary in the state of California. You do not need any medical provider. You don't even need to tell your doctor. I obviously tell my patients to, but you don't need it. but they can go in, and what they don't understand is the people behind that desk. And this is why I really am a huge advocate of pharmacists in every dispensary. That's just my soapbox, even though I'm in a state that has never had that. But I've been very jealous of the other models, especially when the pharmacist does need to be in the dispensaries in different states. And what I find is that the states that don't have them, the people there, the bud tenders, there can be very educated bud tenders, very uneducated bud tenders, but either way, they're not healthcare professionals. So legally, they are federally not allowed, like by the government, to say any health-based info. They could completely get the place shut down if they did, because they are not healthcare professionals. So they're going to recommend what other customers use, not patients, other customers, because at least in California, we're both rec and medicinal in pretty much every dispensary. So when you go in, they're going to recommend the 5 milligram gummy, because that's what so many other patients take for insomnia. That's what that 1-to-1, that 10 milligrams CBD, 10 milligrams THC gummy, go for that. Yeah, because that's what my other patients take. Talk to a healthcare professional who knows cannabis, because they will, or if you're lucky enough to live in a state where they do enforce pharmacists, then please speak to those pharmacists and don't just say, nah, I'm all set. I think I know what I'm going to get. And the reason is because of that whole concept of high. Somebody could say, oh, well, yeah, I use all this and that. My tolerance is really high for all these drugs. I can use whatever. And a 0.5 milligram, 0.5 milligrams of THC might be too much for the patient. And for others, like for me, CBD is very effective for keeping me stimulated. But if I have CBD past 7 p.m. at night, I'm up all night. So that's, again, why you need to speak to somebody like us, one of the healthcare professionals that works and is an expert in cannabis, because you can't just trust going into a dispensary and hope for the best. You really need a healthcare professional either there on site, or at least somebody to talk to about it, because it's such a crapshoot of knowing good products, of knowing which dose, and knowing this was my response. What is the best next step? That's what we're here for.
I was going to say too, not just to target your experience for the patient or user, but also if you're actually trying to use it for a medical purpose, you're not going to get the maximum benefits if you just pick whatever they got their last patient. Yeah.
Very true. Along that lines, we've all talked a little bit about different products and stuff we would choose and stuff, different ways to achieve goals and stuff with CBD, different cannabinoids and stuff. What do you guys look at, and how do you counsel patients on choosing a product that is good and it's going to be a safe product? I'm kind of talking about, do you guys recommend that they look at their certificates of analysis and stuff like that, so they can kind of get an idea of what they're consuming and how safe that product is? Let's start with Cassandray.
So I try to be as thorough during an evaluation with a patient as I can be. I try not to get too specific in brands. Like I said, I'm a community pharmacist as well, and we have a case up of different CBD products from, like, I guess they're big brands across the nation. And so I looked at those one day and I was just like, I actually like the local grower here in Georgia, and I'd like to recommend with their bacon, because, I have a relationship with that farmer. I know I've been to their laboratory. I've seen, that's what I prefer to do. So I try to map out the dosing and everything for the patient, and then recommend, this is the product that I prefer that you use for this condition. But if there's something that they bring to me, I have a friend that used this, or, then we could lean more towards a brand, but I really try to stay away from that, because, another issue I have with patients is that they want to know the concentration of THC and how high is it. And, those things are I don't even want them to get confused about things like that. I just want them to focus on, treating their condition, not really getting wrapped up in all the brands out there, because there's so many, it can be overwhelming. And just really try to focus on the cannabinoids themselves and what they should be using to treat their conditions, making sure you have a good balance of all the terpenes, the cannabinoids, to treat whatever condition it is. Like I said, I try not to get wrapped up in brands because they can get so focused on those things.
Thank you. How about you, Dr. Leah?
So a couple things. I absolutely agree with you. I think the THC percent is like the most frustrating question that I hear people ask at dispensaries, and it makes me cringe. And just like, and what I always like try to explain to people about THC percentage is a plant is an entity, which means it has 100%. That's it. So if you're going up at THC, what are you losing out on? And that's what people forget. And I've spoken to patients some of the harder patients to treat are actually patients who are rec users as well, because it's like, oh, well, that dose is no longer working. It's like, well, how much are you taking at night? And that might be why it's not working. And then it's just that whole balance. But the funny thing is, for some rec users, they go, well, I've been a rec user for forever, and now I want to use it medicinally, but it's not helping me medicinally. And I say, okay, what type are you looking for? They go, I go for the highest THC percentage. I go, okay, next time. And I know this sadly does not exist in every state. I wish it did. But in California, some dispensaries will allow you to smell flower if you are flower utilization for medicinal. And I say, smell it. If it smells strong and it smells not just like cannabis, but it has a fruity smell, a piney smell, if it's something that makes your body kind of almost feel relaxed and feel better when inhaling it, that's usually a good way to go. And then I say to them, after doing that, then look at the percentage. And every single person has pretty much told me between 15 and low 20s. So the answer is that you go up in THC percent, you go down in terpenes, you go down in the polyphenols, you go down in the other cannabinoids. You're losing a lot by going up in the THC. And it's a parabola. Like, that's how it works for us. Once you hit a certain point of utilization, you're not going to get more. It goes back. You just get more side effects. So why aim for something that's not effective? So I completely agree with that point. I was also going to mention too, that I always, just like every other, I really utilize cannabis therapy the same way that I like recommend and discuss medication therapy to Western medication therapy to patients, which is you need something depending on what your ailment is. So pain is a great example. You've got breakthrough pain, you've got preventative pain meds. So I always explain to patients when you're using, and I don't really like the term edible, because edible almost always usually means candy or cookie or something with sugar in it. And as we know, as pharmacists, sugar leads to inflammation. Inflammation leads to more pain. So really not the best way to go. Plus, a lot of our pain patients are diabetics. We really don't want to go to edible, but we can go to oral. And so that would be a oil-based tincture. It would be that taken with cannabis products in general, ingested with a fatty meal, will help the absorption of it. So I always say that, the liquid oil tinctures or the pills or capsules are really, really great for maintenance therapies to prevent the need, to prevent the pain from coming. But then you also want something for breakthrough. And there's a couple options. You can do a alcohol-based tincture. And I separate those two because in the cannabis world, they like to say the word tincture. Tincture, based on definition, means alcohol-based, not oil-based. And pretty much all of these are MCT oil-based or coconut oil. And the problem with it is that people don't realize that they actually did a study. They compared Sativex, which is a non-FDA, but in other countries that it is an approved cannabis spray. It's a 1-to-1. I think it's 2.5 milligrams of CBD and 2.7 milligrams of THC. I might have those two reversed. But what they did is they did a study about people using Sativex and people using a oil tincture that was identical. What they showed is they both took about an hour to kick in. So one was transmucosal, one was an oral tincture that they just swallowed. At the end of the day, if you're swallowing it, it's going to go through first pass effect. So any tincture that's oil-based, most likely going to be long acting, most likely, no matter what it says, most likely going to be long acting. So you need both. You need breakthrough stuff, and inhalable vape or flower, however you want to do it, is a good breakthrough pain because it instantly fixes it. But if you don't want to inhale, the alcohol tinctures. Last thing I wanted to say was you brought up the concept of SOP, not SOPs, I'm sorry, the certificate of analysis, the C of A. So it's a hard question because the answer to your question about a couple months ago, I would have said, yeah, I always look at the C of A. Yeah. And now what we're realizing is it's artificial so often. It's so often that you think it's a lab report. How can it be a fake? There's no standardization. So it's often, you can trust it if you trust the company. So just like you said, you trust that grower, you know their product, you know they're effective. So you can trust their C of A. But if it's a random company you've never heard of before, you don't know how good they are, you don't have any other patients on it. So I always do about the same thing as I find out what I want to use for the patient. Then I ask them, is there a dispensary you would like to use, or do you just want one in your area? They tell me either way. Then if they say a specific dispensary, I go to that website and I look at all the different products at that dispensary. And then I go through, I look at ones I've heard of before, ones I haven't. Then I actually literally research that company. I look at testimonials, I look at other patient responses, all that mess. And so then I will usually give my patients a list at one dispensary, if they've chosen it, a list of about 2 to 3 different products that I would recommend for them to start with. If they don't have a dispensary, I will recommend a product that is sold in that state that I know is effective, and say, here are 2 to 3 products, and here are about 3 dispensaries that have it. As a safety measure, and I only know this because I work with a cannabis pharmacist lawyer, so he's all 3. And what he always explained was you have to be very careful because in this day and age, dispensaries are considered commercial, in their business. So we as pharmacists can't recommend a single dispensary, only because we as pharmacists can't recommend CVS, Walgreens, Rite Aid. It's the same concept, but we can recommend a product just like we can recommend a atenolol versus propranolol, and make a recommendation to the provider. So I always say for those who are working in cannabis, make sure that you don't recommend a specific dispensary, let the patient choose. If you know that there is an issue with that dispensary, you could say there's an issue with this one based off of this information, and make sure to have a document of showing that there's an issue with it. And then direct them to a couple more reputable ones, as well as directing to a reputable product. So sorry for that. It was a bit long.
Oh, that was great. Thank you, Dr. Leah. How about you, Becky? Dr. Becky?
Yeah, I look at COAs, I look at the labs and the company. I have a brand that I've partnered with locally, and I trust them, and I know their stuff is, legit online and everything. If someone doesn't want to use that brand, I'm typically like, okay, go to this grocery store that I know sells at least a non-GMO. I like to say on my website, CBD is really the Wild West. You can't tell if there's CBD in it, much less if it's even oil. They can put a label on it and say it's CBD oil, but who knows what's in it. And then there's all the language about hemp seed oil or hemp oil or all the different, there's probably 15 different ways they say something that leads a consumer to believe it has CBD oil in it, right? So that's my main hurdle, is that because we have to have a card to get anything with THC in it, I know that I'm pretty much going to go with them or recommend something that I know I have familiarity with. I've seen it in the stores. I've looked at their labs. I know what typically I don't do a lot of edibles either. I'm kind of with you on that. I really love sublingual oils, and I'm also in recovery, so that keeps me safe from using alcohol-based tinctures as well. So, and I like the concept of layering, is really kind of taking that pain management model of having the long acting, having the short acting, and then you can also, add topicals, or, it's about their experience, what they want, but also, managing it, staying ahead of it, and kind of using those other tools, you can say like, I recommend an Epsom salt bath before you apply the topical and then moist heat. Or, for example, like you're kind of getting them to do those lifestyle things too. It's kind of like the tricky way of helping them with their pain. Does that answer your question?
Yes, it does. And I can remember when we were at Patients Out of Time, the cannabis conference earlier this summer. We were at that outdoor event. I think it was the first night, and I remember you were having some difficulty and stuff with pain. So you, right there in the event, you like kind of did some stretches and stuff. So that, to me, it just proves that you're living what you're preaching too as well. So.
Thanks.
And
Yeah.
I do the same thing, and sometimes people give you a little bit of an odd look sometimes, but hey, it works. As far as what I do,
hair, so I kind of expect odd looks sometimes when you have purple hair or blue hair or whatever. I'm bringing the fun, right?
it's original.
Yeah.
Kind of what I do is a little bit of what all of y'all kind of do. I do look at the COA, but I also smell the product. In Oklahoma, most places, during COVID, it was, they didn't allow you to smell cannabis. A lot of places didn't anyway, but now, a lot of places are back to, and they're fine with you doing that stuff. But I don't remember the name of the lab. Becky might remember of them, but I'd say a year and a half, 2 years ago, something like that. Something Dr. Leah had mentioned, is sometimes those lab reports are just bogus. We had a lab, cannabis testing lab in Oklahoma that got busted for falsifying information and stuff on those COAs. And I think for myself, one of the things that I look for a lot is safety, and I think that was probably ingrained in me from when I worked for a company called Owen Healthcare and Hospital Pharmacy. They always preached, you look at safety first, you look at efficacy second, and then cost last. So what I always want to make sure is that say we're using, say I'm recommending a cannabis flower or something like that for somebody. Well, I want to look at the COA to make sure that, granted, it could be falsified, but I want to make sure that I'm not exposing my patient to heavy metals. I want to make sure I'm not exposing them to toxins, microbes, gross contaminants, anything, that could be detrimental to their health, So that's one of the first things that I kind of look at when I'm looking at the COAs to make sure it kind of passed all of its tests. But I go by smell just as much. Probably I rely on that more than probably the COA. I mean, I look at the COA mainly for the safety profile, as far as make sure it's passed everything and stuff. And I have a buddy named Jerry that he owns Silverleaf Cannabis up on the north side here, and he and his wife own that dispensary, and they were kind of just, when I was a little bit newer in this everything, they were kind of educating me a little bit and helping me and showing me that they like said, smell this flower. I said, oh, that smells really good. I can tell that's got strong terpene profile. They said, well, it only tested at 0.75 or something like that, and they say we know by just smelling this has more than 2%, probably just from our experience and stuff. So I mean, you can't always rely on everything exactly that the COA says, but I do like looking at
Erik, we do need to wrap it up. Okay.
Okay.
It's been about an hour.
Okay. Well, that was kind of the last thing I was going to go talk about anyways. Just looking at efficacy and safety all together, as far as the whole picture and stuff for the patient and stuff. So I just think it's neat that a lot more pharmacists are in this cannabis space now, and I think it's really important that we're out there, educating patients, physicians, and our other colleagues on the benefits of cannabis. We as pharmacists, we see so much polypharmacy. I've lived polypharmacy for quite a few years, and that doesn't lead to anybody's increased quality of life. I think we all kind of are in it probably for the same reason, that you know, we're here for the patient. We want what's best for the patient. So I just appreciate everybody being here with me today. Cassandray, Becky, and Dr. Leah, I appreciate y'all being here and discussing utilizing cannabis as therapy for chronic pain. So thank you all.
Thanks, Eric. Thanks, Vivian, for this opportunity too.
Yes, thanks, Vivian.
Eric.
Thank
Thanks,
you.
Vivian.
Sure. Thanks very much, guys. Have a great day.
You too.
Alrighty. Are we done then?